The United Nations Development Program is the principal recipient of grants from the Global Fund to fight AIDS, tuberculosis, and malaria in the Kyrgyz Republic since January 2011. Subrecipients of the grant are the Republican AIDS Center, the Bishkek City AIDS Center, the Republican Narcology Center, the Scientific and Production Association Preventative Medicine, the World Health Organization, UNICEF, and non-governmental organizations. The grant rating is A2. In 2013, the first single window for people living with HIV was opened in Kyrgyzstan on the basis of the City AIDS Center. This is unique not only for Kyrgyzstan, because it has no analogs in Central Asia. In 2012, an order of the Ministry of Health was prepared on the opening of an integrated approach to HIV, tuberculosis, and drug use. We prepared a draft order on the opening of the pilot project at the City AIDS Center, which was approved by the Minister of Health. The essence of integrated comprehensive services is that a person receives antiretroviral drugs for HIV, methadone, and anti-tuberculosis drugs in one place. Here, there is a multidisciplinary team, which includes an infectious diseases specialist, narcologist, skin and venereal diseases specialist, urologist, psychologist, and 2 members of the community who have a personal investment in methadone therapy. In fact, much work was done. The work was carried out both by the Ministry of Health and the City AIDS Center, with financial and moral support from UNDP. I know that Ukraine leads in the highest number of HIV-positive cases in the region. So, with the support of UNDP, 2 delegations visited training seminars in the Ukraine, where they became acquainted with the work of AIDS service organizations, governmental and non-governmental. We can say that it will be very difficult to stop HIV without the assistance of the international community presented by the Global Fund and UNDP. Thanks to opening a single window, clients no longer have to travel to different parts of the city for medical aid. As best practices in developed countries show, the integration of medical and social services under one roof and the creation of multidisciplinary teams capable of a comprehensive approach to solving the problems of the patient is the gold standard in providing services to people with HIV. In 2014, UNDP will work to open similar points in other regions of Kyrgyzstan. Worldwide experience shows that one of the most effective ways to prevent the spread of HIV and hepatitis among people who inject drugs is substitution therapy. According to the World Health Organization, opioid substitution therapy is recognized as an effective method of preventing HIV among people who inject drugs and improving adherence to antiretroviral therapy among people living with HIV selected for the treatment. The OST program has been implemented in the Kyrgyz Republic since 2002, and today, UNDP, together with the Republican Narcology Center, is actively working to expand the network of OST points. To date, there are 29 OST points, including 22 in the institutions of civil health care, 7 in the penitentiary system. As of January 1st, 2014, the actual number of OST clients was 1,050 people, including 234 in prisons.
In total, today, there are 20 OST sites functioning under the agreement with UNDP. In Bishkek, 4 sites. In Chuy Oblast, 7 sites. And in the southern region, 11 sites, including Batken Oblast, Jalalabad Oblast, Osh City, and Osh Oblast. As a result of work carried out jointly with UNDP in the past year, we have opened 3 new sites of substitution therapy. 2 sites in Karasu district of Osh Oblast, and 1 site in Panfilov district on the basis of the FGP. Also, there was conducted a number of measures aimed at creating conditions for functioning of sites for methadone substitution therapy. Alarm buttons are installed in all rooms for methadone issue. All clients are provided with clean drinking water. We had a problem with water, mainly in the southern region. Therefore, today we supply clean drinking water to the sites throughout the country so that they take a dose of methadone with water.
The main objective of the program is that when a person tries to quit injecting drugs, methadone helps to reduce physical pain or withdrawal sickness. When taking methadone, a person may freely work, drive a vehicle, and feel adequate, or reintegrate into society.
The methadone program helps to decriminalize people who inject drugs, and thanks to methadone, people stop robbing and stealing. They remain free citizens. They provide for themselves. Many of them begin to work. If they were imprisoned, the burden of their maintenance would lie completely on the state.
In November 2012, a pilot project of saliva-based rapid HIV testing for at-risk groups was launched in Kyrgyzstan with the support of UNDP under the order of the Ministry of Health. The motivation for the introduction of rapid testing was the fact that the vast majority of funds allocated by the Global Fund for HIV diagnostic test kits was spent on testing cohorts with minimal and sometimes zero prevalence of HIV.
Since November 2012, with the support of UNDP, we were able to begin the process of rapid saliva-based testing on the basis of 12 NGOs. This process helped to improve the identification among the most vulnerable groups. In particular, our organization is working with the most closed group, men who have sex with men. Statistics in this group previously showed virtually 0% prevalence, but in fact, the figures are quite different. Due to the closed nature of these groups, their refusal to go to the AIDS Center for diagnosis, the availability of these tests also allowed us to show MSM that these procedures are not something terrible, that they are common medical procedures that do not require a large investment of time. In particular, for the 2012 to 2013 year, our organization referred 10% of the total number tested to the AIDS Center with a preliminary positive result. There, their results were confirmed by analysis of blood. Results of the pilot project showed that from November 2012 to October 2013, the selected NGOs were able to test 4,500 people from among their clients. 226 of these people were diagnosed as HIV positive. These results necessitate an increase in the number of governmental and non-governmental organizations providing HIV testing in order to reach the greatest number of people at risk: those who inject drugs, sex workers, and men who have sex with men.
According to the recommendations of international experts and the requirements of the Global Fund, medicines and medical products should be stored in appropriate conditions. Consequently, under the HIV grant, there were repairs in pharmaceutical warehouses in Osh, Botkin, Narin, Talas, and Chuy Oblast AIDS centers in 2014. Also, a pharmacy and pharmaceutical warehouse for the Osh Narcology Dispensary was renovated, as well as repairs in the OST points of Karasu District, Osh Oblast. According to the recommendations of WHO experts and PCR laboratories of the Republican AIDS Center and Preventative Medicine were also renovated. A pharmaceutical warehouse and OST point at a single window were renovated in a city AIDS center. Also, there were repairs in penal colonies where the OST points were opened in 2013. All this helped to improve the quality of storage and distribution of goods purchased under the HIV grant. 10 NGOs working with people living with HIV and their families, including 2 national networks of people living with HIV and 8 NGOs, have been supported as part of the Global Fund grant implementation since 2012. During 2013, the services of non-governmental organizations working as part of the Global Fund grant covered 1,613 people living with HIV. The aim of the NGO's activity is to refer people living with HIV to AIDS centers, as well as to increase clients' commitment to clinical examination, diagnosis, and treatment. There are a lot of problems related to people living with HIV, such as stigma and discrimination, document recovery, and fear of people. People are afraid. We, as an NGO, work on this with the support of the Global Fund. Our organization is working directly with the local people living with HIV, providing them psychosocial support, accompanying them to special service organizations or governmental organizations, and helping to restore documents. The UNDP, as the principal recipient of the Global Fund's TB grant in Kyrgyzstan, is actively working to expand access to diagnosis and treatment of drug-resistant TB by strengthening human and institutional capacities. Daily surveillance of drug-resistant tuberculosis is carried out across the country. The modernization of laboratory services, provision of timely treatment of drug-resistant TB, and provision of appropriate support for patients to form adherence to treatment have also been promoted. Subrecipients of the grants are the National Center of Physiology, Bishkek City TB Center, as well as Oblast TB Centers and the State Service for the Execution of Punishment of the Kyrgyz Republic. Grant rating A1.
UNDP now is implementing almost all the activities planned under the National Plan to combat tuberculosis for 2013 to 2016. The results are already obvious. In 2013, it managed to reduce discontinued treatment. In 2009, discontinued treatment was 33.8%. But in 2011, according to the results obtained by us in 2013, this figure was reduced to 12.3%. We managed to increase the success of treatment by 15%, according to the results for 2009. If the success of treatment was 42%, then according to the results of 2011, treatment success was 57%. We expected to increase this indicator annually by 2 to 3%. But the result was increased by 15%. We improved detection. If you noticed, in 2005, there were just 25 patients. In 2013, we had more than 1,000 patients on treatment. In addition, UNDP assisted us in identifying the number of patients. The number of these patients increased. There was a need to buy more courses of treatment, and UNDP immediately responded to this need. Last year, we had a shortage of drugs for 300 patients. Recalculations were made, and UNDP procured drugs for 300 courses. The same calculations are needed for 2014, and 165 more courses were planned. UNDP covers activities that improve the success of treatment. The first problem was the social helplessness of patients. UNDP responded to this problem correctly, providing motivational support to patients, transport services, and social food packages. The next step was social support to staff who provide medical assistance for patients.
During the reporting period, UNDP purchased anti-TB drugs totaling more than $3 million USD, as well as medical products totaling $384,876 USD. 1,198 people received anti-TB drugs purchased by UNDP. Also, there were conducted various trainings for TB specialists, PHC nurses, and laboratory staff. Great attention is paid to the technical assistance and provision of medical products for TB facilities in Kyrgyzstan.
Ongoing technical assistance provided by the Global Fund enables us to continuously carry out the required work for infection control, timely diagnosis, and treatment of patients with MDR-TB, namely by providing respirators for medical workers, germicidal lamps, and refrigerators to store Pfizer and more.
Kyrgyzstan expects to obtain a certificate as a country free of malaria. This success was achieved thanks to the intensive anti-malaria events held during the last 8 years. There was not a single case of local transmission of malaria or parasite carrier in the Kyrgyz Republic from 2011 to 2013. Subrecipients are the World Health Organization, Karasu District Center for Disease Prevention and State Sanitary Epidemiological Surveillance with the function of service coordination in the oblast. Grant rating A2.
35,000 mosquito bed nets used to protect the population from the bite of mosquitoes were distributed in 2012 to 2013 with the financial support of UNDP and the Global Fund, including about 7,000 for pregnant women and 25,000 for children under 5 years of age. They were distributed throughout the country. The hard-to-reach areas were covered in the border territories of the country as well. Household treatments were conducted in Jalalabad, Osh, and Batken oblasts. For this purpose, 1,140 kilograms of insecticides were purchased, and two-stage household treatments were undertaken. Special clothing for specialists who carried out household treatments was purchased for this purpose with support of the Global Fund. In addition, 206 people were trained with support from the Global Fund. Certificates from the WHO were provided to the National Parasite Laboratory, which participated in the international interstate trials. We soon expect to receive a certificate of malaria elimination in Kyrgyzstan.
UNDP is a trusted partner of the Global Fund and national institutions in Kyrgyzstan. More than 100 organizations and service delivery points take part in the work of 3 grants. More than 600 employees of medical institutions and NGOs are involved in the implementation of measures that combat HIV, tuberculosis, and malaria. In 2013, the total disbursement of Global Fund funds on the 3 diseases was $18,780,333 USD. More than 1,000 people continue to receive vital ART. More than 800 patients with MDR-TB began to receive therapy in 2013. More than 1,000 people receive methadone substitution therapy. In 2014, UNDP plans to make the emphasis on strengthening national capacity of AIDS and TB services. It will continue to provide technical assistance to Kyrgyzstan jointly with WHO, UNAIDS, UNICEF, and other development partners. Thank you for working with us in 2013. We look forward to continued cooperation in 2014.